Okay, let's do a deep dive. Imagine a situation where having someone truly in your corner in healthcare could be the difference between getting the right treatment or, well, facing preventable complications, maybe even worse. That highlights something incredibly important, doesn't it? Patient advocacy.
It really does. And, as we'll see, it's so much more than just speaking up.
Yeah.
It's a fundamental piece of ensuring quality care. But the journey of an advocate, well, it's filled with surprising and often complex hurdles.
Exactly. So today, our mission is to unpack patient advocacy. What does it truly entail? Who are the different people doing this work?
Yeah.
And what are the significant challenges standing in their way, whether they're navigating, say, a complex insurance system or working inside a hospital ward?
And to do this, we've pulled together a stack of sources with really diverse perspectives. We've got insights from a qualitative study looking specifically at the barriers nurses face in a hospital setting in Ghana.
Okay. And we're also drawing on an article that examines how patients in the U.S. with chronic diseases are increasingly becoming advocates, for themselves and others,
Right.
grappling with systemic issues, particularly with insurance, in a landscape post-ACA.
And we're grounding this with material from guides and fundamental resources that define patient advocacy, outline the skills needed, and discuss different roles. There's some excellent foundational content from a quality authority in Ireland, actually.
Great. So our goal is to synthesize these different viewpoints, sort of cut through the complexity and get to the core of what's most important for you to understand about this vital role.
All right, let's unpack this then. At its core, patient advocacy is about supporting, empowering, and being the voice for someone receiving care. It means acting on their behalf, helping them secure their human rights, and, ensuring their interests are represented.
So the purpose is really practical then, helping people articulate their needs and preferences, making sure they're understood.
Exactly. Assisting them in accessing information about their condition and options and helping them think through the potential outcomes of different decisions.
Okay.
It's absolutely central to what's known as person-centered care, basically, putting the individual and their unique needs and values at the heart of everything.
And it's crucial to understand what advocacy is not, right?
Yes, definitely. It's not about stepping in and making decisions for someone, even if you think you know best.
Right.
It's not trying to persuade or convince someone towards a decision you prefer. And critically, it is not ignoring or overriding a person's stated wishes or preferences.
That idea of will and preference seems really key here,
Yeah.
especially you mentioned highlighted in the Irish source.
Right.
What exactly does that encompass?
Well, will and preference is essentially a person's own choices, their wants, their wishes for their life and their care. It's about what matters to them.
Yeah.
And this isn't just about verbal communication. It can be expressed through gestures, behaviors, facial expressions, really any way a person can signal their desires.
And respecting that, truly centering it, is not just good practice, it sounds like. It's fundamental to a human rights-based approach in healthcare.
Right. Absolutely. Now, when we look at who actually does this advocating, the sources show it's a really broad spectrum of people.
Sure.
Registered nurses, for instance, are explicitly called out in some materials as having patient advocacy as a core part of their professional role. And more generally, healthcare staff are often seen as protectors of patient rights and autonomy.
But it extends far beyond clinical staff, doesn't it?
Oh, definitely. Patients themselves become powerful self-advocates, learning to navigate their own care and speak up for their needs.
Yeah.
And family members frequently step into this role, out of necessity and care.
Of course.
And then we're seeing the rise of professional patient advocates, individuals who work independently, perhaps helping clients navigate, say, insurance complexities or connect with resources.
Right.
Plus, there's the significant force of advocacy organizations and patient-led coalitions, especially when tackling those bigger systemic issues.
And the path isn't always clear-cut, is it? Like licensed or uniform roles.
Not always, no. And roles can specialize heavily, from insurance navigation to specific medical literacy. It varies quite a bit.
Okay. This is where things get truly complex and, frankly, often frustrating, it seems. Despite its absolute necessity, advocacy runs headfirst into significant barriers.
Absolutely. Let's maybe start with the systemic level, particularly the challenges highlighted for chronic disease patients in the U.S. context.
Yeah.
Even with protections from the Affordable Care Act, the ACA, like covering pre-existing conditions, the battle isn't over, not by a long shot.
The source describes conscious institutional discrimination by insurers. So it's not about denying coverage outright anymore. It's more subtle.
Exactly. It's about creating obstacles that make it incredibly difficult to access the care needed, even when it's technically covered.
How do they do that?
Well, a prime example they discuss is step therapy, or sometimes it's called fail-first protocols.
Ah, right. I think I've heard of that.
Yeah, insurers require patients to try a sequence of cheaper medications first before they'll cover the one their doctor actually believes is best. You have to fare on the cheaper options first.
And for someone with an aggressive chronic condition like MS, lupus, Crohn's, rheumatoid arthritis, the source mentioned that delay must be devastating.
It can be. It can lead to irreversible damage while the patient waits, trying and failing these other medications. It's a tactic that clearly benefits the insurer financially, right? Pushing cheaper drugs.
But it's profoundly harmful to the patient's health outcomes.
Profoundly.
Right.
Then there are these artificial financial restrictions. Healthcare is expensive, we know that. And many people rely on charitable assistance for things like premiums or copays. Insurers have apparently found ways to make it hard for patients to actually use that aid, sometimes even targeting patients who do.
Targeting them? How?
Well, the source uses the specific example of kidney failure patients who become eligible for Medicare before 65 if they use charitable assistance to pay for their supplemental insurance. Some insurers have reportedly found ways to deny accepting those payments, which essentially tries to push very vulnerable patients into fewer, potentially inadequate coverage options.
Wow. The source called it an arms race.
Yeah, an arms race between the institutions trying to lower costs and the patients desperately needing access. That's a powerful description.
It really is. Okay, shifting gears entirely then. The study from Ghana offers a different lens on barriers, right? Focusing more internally.
Exactly. Inside the healthcare setting. The main theme they found was a profound lack of cooperation between the different groups involved, the healthcare team, the patients and their families, and the institution itself.
So within the institution, what kinds of issues did nurses face?
Things like a lack of support from colleagues or superiors. They also dealt with inadequate resources and supplies. I mean, the study mentioned a nurse struggling because they didn't even have a proper bag for blood collection.
Just basic supplies.
Basic supplies. And funding issues were significant, too, like the National Health Insurance Scheme, the NHIS, not paying for emergency drugs, forcing really difficult choices.
And what about communication?
Oh, communication breakdowns were rampant. Nurses struggled to interact effectively with other staff, particularly physicians.
That sounds tough.
Yeah, one nurse in the study was quoted saying something like, "At times, some of the doctors are not cooperative at all because they think that they are ahead of us. When you suggest to them, some take it, but others will not take it and refuse your offer."
Yeah.
Yeah. And there were also issues just getting the necessary personnel available or even willing to act on an advocacy concern.
It sounds incredibly frustrating. It really highlights how, even with the best intentions, just the structural and interpersonal dynamics within the workplace can be huge barriers.
Exactly.
What about barriers related to the patients or families themselves? Did the Ghana study look at that?
It did. Lack of family support was a major one. Families sometimes felt or were perceived as dumping patients and wouldn't even answer calls. Oh, that's hard.
Really hard. And religious and cultural beliefs, or sometimes simply a lack of health education, could lead to disagreements or make it hard for patients or families to accept or act on health information and advocacy efforts.
So sometimes the advocacy might even be rejected by the patient.
Yeah, the study mentioned that sometimes patients themselves, maybe due to poor knowledge, might reject the advocacy a nurse was trying to provide for them.
And finally, the study looked at barriers specific to the advocate, the nurse in this case. This struck me as particularly powerful, the personal cost and fear involved.
Absolutely. Nurses in the study feared negative outcomes from their advocacy attempts, that it would fail, or worse, that they would get into trouble.
Yeah.
One nurse reflected on a superior canceling their action, and just that feeling of defeat, saying, so the next day, you wouldn't want to do anything again because nothing good will come out of it.
That's just heartbreaking. Destroys morale.
It really is.
Yeah.
And there was also a very real fear of job loss or being transferred as retaliation.
Sure. Yeah, another nurse put it starkly, if I don't take care, I am going to be transferred, then I will not do it again.
Wow.
So previous negative experiences really discouraged future advocacy. And then there are the practical hurdles, right? Simply having limited time alongside maybe inadequate knowledge about a specific condition or the advocacy process itself.
So when you look at those systemic financial pressures in the U.S., the resource and interpersonal hurdles in the Ghana hospital, and then these personal fears of the advocates, it paints a picture of a role that is essential but constantly under siege from, like, multiple angles.
Precisely. It's an uphill battle on many fronts, which is why understanding how advocacy actually works in practice, despite these challenges, is so important. And the sources outline different types and approaches that people use.
Right, like self-advocacy,
Yeah.
where the person speaks for themselves.
Exactly, maybe with some support. The Irish source gives this great example of Paul, an older man with dementia. With staff support ensuring he got clear, understandable information, he was able to insist on making his own decision about surgery. The staff's role was crucial, but it was about facilitating his voice.
That's a great example. Then there's independent advocacy.
Yeah, this is provided by a third party, ideally with the person's consent. It's often needed when there's a potential conflict of interest. Maybe the healthcare staff's duty to the institution versus the patient's specific wishes,
Wow.
or if the person needs significant support with decision-making, or just feels their rights aren't being respected.
So this type involves actively speaking up for or standing alongside the person.
Exactly. Making sure their will and preference, even if it's difficult to figure out sometimes, remains absolutely central.
Is there an example for that one?
Yeah, the Irish source talks about Claire in a nursing home. Her strong preference was to go home, but that conflicted with her family and the staff's views.
Yeah.
So she accessed an independent advocate who helped her concerns be genuinely heard in a meeting. And independent advocacy can take different forms, too. Well, empowering the person to voice their own concerns, representing them directly, or in really complex cases where the person can't instruct, a trained professional might do non-instructed advocacy.
Non-instructed, what's that?
It's where the advocate observes carefully, gathers information from different sources, all to try and determine what the person's likely wishes and preferences would be based on their values and past choices.
Okay, that's complex. And beyond individual interactions.
There's the power of collective action, right? Through patient groups and community advocacy. The U.S. source provides excellent examples here.
Like Chronic Disease Day.
Yeah, Chronic Disease Day, celebrated on July 10th, 7/10, which is a great example of just building awareness and community conversation around the fact that, 7 out of 10 people in the U.S. live with chronic conditions.
That's a huge number.
It is. They also mention ambassador programs that build networks for civic engagement. Like one group developed an educational program about endometriosis for doctors.
Oh, interesting. Targeting the professionals.
Right. Directly impacting care by improving understanding. And collective advocacy can really push for policy change. The source mentions the Living Donor Protection Act in Oregon.
What does that do?
It protects living organ donors from job or insurance discrimination. And the source highlights how powerful the personal stories of patients and donors were in actually getting that legislation passed.
So, individual stories driving systemic change.
Exactly. It's clear that different situations call for different approaches, but all of them require specific capabilities, right? Looking across the career guide and the healthcare fundamental sources, certain skills consistently pop up as essential for effective advocates.
Communication has to be fundamental, I imagine. Not just talking, but explaining complex stuff clearly.
Absolutely. Explaining complex medical or financial info, but also being really attuned to nonverbal cues and social dynamics.
And interpersonal skills, too. Building trust.
Critical, building trust, positive relationships, active listening, genuine empathy. These are like non-negotiable.
And the specific advocacy skills, negotiation, planning.
Negotiation, careful planning, doing thorough research, and always, always acting unequivocally in the patient's best interest, even when it's really hard.
Problem solving must be huge, too. Navigating unexpected hurdles.
Yeah.
And attention to detail.
Vital. Especially when you're dealing with complex documentation like medical records or insurance forms, good organizational skills kind of tie it all together.
Okay.
And finally, a successful advocate needs to understand the context. That includes things like financial literacy, familiarity with how the healthcare system actually works.
Not just how it's supposed to work.
Exactly. And a solid grasp of relevant legislation and patient rights. The Irish source really emphasizes that for healthcare staff, empowering patients specifically requires being respectful, non-judgmental, building strong relationships, actively encouraging involvement, focusing on the person's strengths, making sure they know what services are available, and helping them understand their rights.
Thinking about all these layers of challenge and the skills required, it really brings us back to why this matters so profoundly. The stakes of patient advocacy are incredibly high.
They really are. The Ghana study offered that stark reminder of the consequences when advocacy attempts are unsuccessful.
Yeah, you mentioned that.
They were linked to serious negative outcomes for patients, including increased complications and, tragically, even death. And there were also negative repercussions for the health institution and the nursing profession itself when advocacy failed.
So the ultimate goal, the reason this role is so vital despite all the difficulty, is really about enhancing the quality and safety of patient care.
That's it. It's not just about making someone feel heard, although that's important. It has tangible impacts on health outcomes and overall well-being.
So pulling all of this together then, we've taken a deep dive into patient advocacy, seeing it as this really crucial, multifaceted role that operates under constant pressure.
Yeah, constant pressure is a good way to put it.
We've explored the significant and diverse barriers, haven't we? From that systemic arms race with insurers in the U.S. to the day-to-day resource limitations, communication issues, and those very real personal fears faced inside a hospital setting like the one in Ghana.
And we've looked at the range of players involved, from individual self-advocates and family members to professional advocates and powerful collective groups.
Right. And identified the key skills needed to navigate this complex landscape effectively.
Yeah.
Understanding these challenges and the different ways advocacy is practiced, well, it can really help you navigate the healthcare system, whether you're focused on your own health or supporting someone you care about.
Absolutely. And it kind of leaves us with a thought that resonates across all these different sources, doesn't it? Given the relentless evolution of healthcare systems and these persistent pressures, whether they're financial, institutional, or interpersonal, how do the insights from these very different contexts inform your understanding of the continuous and vital need for voices that champion the patient's essential will and preference?
That's definitely something to consider.